some of these. Actually, I'm going to ask you about your career and why did you join the medical field?
Do you want me to start like where I began, like when I started first?
Like, why did you join the medical field? Like, what was your
Um,
interest in it?
so the career I chose, so first I was inquired about the LVN program, but in order to get into the LVN program, I had to be a CNA. So I did the CNA program first to see if I like, I guess it's like a stepping to see if you actually like the medical field or whatnot, which I like. And at that time, I had a daughter. Well, I had a Leah, and she was like, I think she was like 6 months old, and I knew that I had to find a career that was going to be stable. And I had a lot of family members who were in the medical field, and I just wanted to do it for myself and for Aaliyah. So I became a CNA first, and I liked it. And then I went into the LVN program, and then I graduated. Then I started working as an LVN for like, let's say like 5 years until I had my second kid. And that's when I went back to school and took prerequisites to get into the RN program. And then I did prerequisites for about 5 years. And then I got into the RN program. It was an associate's program. And then I graduated and I went back to school to get my bachelor's. And I just graduated last year.
Nice. Okay. So, what is it about being a nurse that you like the most?
I like to feel like I am doing something good for people. I think what really made me wanted to become a nurse, or why I liked it, was because my dad had a stroke when I was like a senior in high school, and I seen like the journey from like being in the hospital and like a lot of the aftercare, like going to rehab, having like nurses come to the house, and anything that has to do with within the medical field, like it really like made me look like made me realize that this is what I wanted to feel like. I wanted to make an impact in families' lives who feel like helpless or like who need care, who just needs, not like the comfort and just to like, make people feel better, like make them, you know, just giving them the support and yeah, that's why I wanted to become a nurse actually, because my dad had a stroke and I just seen the hardship and a lot of, medical team, like, like nurses and CNAs and doctors, like, all the care they provided, how it just made, improves like the quality of life of somebody.
Okay. So, I'm taking classes now for nursing and I'm doing my prereqs. What advice do you have for someone interested in joining the field or someone new coming into the field? What advice would you give them?
Don't give up. It may seem hard, I feel like it can come off as a long path, or it can come off as like challenging, especially with all the stuff you need to learn. But everything that you learn is going for a purpose. Like I feel like everything you learn is going to go towards like what you're going to utilize in your career. If it's math, or is it English, or psychology or something. Those all like play factors into becoming a nurse. I say just don't give up. Take it a day at a time. Take it. I would say like what I say. Basically, don't give up and just keep going. I mean, I failed classes and I felt defeated, but I retook it. So I always felt like, is this path the right path for me? But I feel like if you just leave it in God's hands, like it'll work out. It may not be the path that you choose or the path that you've envisioned, but eventually you'll get there.
Okay.
With time and patience.
Okay, so, and how long ago was this? When was it that you started?
I started like 2000. So I started like everything, like as far as anything with the medical field. Like started off like knowing that I wanted to nurse. Everything started in 2007.
Okay. And you became a actual RN, right? You're an RN
I
now?
became, yeah, I got my BSN last year in August. So I went from CNA, LVN, Associates in Nursing to a bachelor's in nursing. And it took me about a long time.
Okay. And so are you still in the medical field as of today? And do you like, are you wanting to
Yes,
continue this career path for you?
yes, I am in the medical field. I work in psych. So I like psych. I love psych. When I was in LVN, I worked with substance abuse, mostly for like heroin addicts. And I like anything that has to do with mental health illness because I feel that there's so much lack of help and it's really not recognized, or there's not so much resources that's provided to like mental health patients. So I feel like mental health is just something that's, I don't know. I know I wouldn't say like it's better, but I feel like doing more good for my patients as a psych nurse. And I do plan to go back to school for my master's, but I just don't know what type of master's. I don't know if I want to be like a family nurse practitioner, or if I wanted to get my master's in nursing in leadership and education, so I can, you know, be like an educator or something. So I just don't know what field yet, but I do want to go back.
Nice. That's nice. So when you say psych, you mean so it's like pertaining to like behavioral health.
Yeah, or behavioral health, like, it can be like drug-induced psychosis where, they're, like hearing voices or something because they're under the influence of drugs, or it can be like a mental disorder where, been having like for instance, like schizophrenia or something like that, where they need like a lot of medication stabilization or a lot of therapy, group therapy, occupational therapy, where they work with like social relationships with each other, or like, even like drawing or coloring, or like doing magazine, like cutting stuff from magazines, just like the social skills that we do. But yeah, so it's basically people who have a mental disorder.
Okay, so what would you describe like a mental disorder? Say, so for example, I'm just going to use me for an example, right? So I'm laying in bed, but my thoughts are loud. It's not like I don't hear anything, but my thoughts are really loud, and I feel like,
Like you're basically hearing something, like, or like somebody who hears things in their head, and those voices can actually put a danger to you. Like you can hear voices and be like, I want to kill myself, or I have no purpose to live. And then you have another voice that's telling you, why are you doing that? So you're in a battle with your own voices, right? So people who come in who are like that are basically having like agitation, and they just don't know which side to pick. So usually they start them off with like medication stabilization to see what medication would help them with the voices, so they won't hurt themselves or others, or group therapy or individualized therapy. And usually when nurses, like a nurse's responsibility, of course, is, making sure they feel safe, making sure they're not, if they are hearing voices, that you can give them like a medication that can help them, make the voices go away. And usually, I taught sanitation for a long time. Like, why, like, I don't see why, but I said, like, what are your thoughts? Or do you know why you're feeling this? Like, what are your reasons? What's causing all this stuff? So you basically give them support. Because, sometimes people don't have people to talk to,
right.
or like, and I give them the social support and sit with them. And, there's times when patients are concerned where they don't have the rights to their own health. Like kind of like Britney Spears, how she didn't have any rights to
Right.
her life, So
With the proprietorship?
that's the hard part. Yeah,
Okay.
yeah. So it's conservatorship, so that's the hard part, especially when you have young, like adults, like in their 20s, who have made who basically had hardships, like homeless or something, and they started doing stuff that they're not supposed to. Then they put them on conservatorship because they don't have any family. So you're basically forced to take medications. You basically don't have a right to your own care, or you can't say no, basically. And it's sad because, like, with medication stabilization and them not hearing voices or are on the right path, they tend to get more like, I don't want to say the word crazy, but they tend to get more crazy because they're stuck. They have no place to go. That's why they act the way they. It's like a revolving cycle. You know, you can't get out of the hospital because the judge has to give you an okay. But in order for the judge to be okay, you have to be on a good path. But it's hard for you to get in a good path because you have no rights. Like, you're tired of being locked up in a room with other people, locked up in a psych unit, and that's when you start being aggressive towards others, and the cycle breaks again. It keeps going back in circles where, you know, it's like you have to be on good behavior for like 30 days, and you have one, you know, blow up of yelling, you know, at somebody and stuff, and it breaks again, and it's a cycle. So that's the sad part. That's why I feel like when nurses come into play, that's when we give them, you know, more care, like not more care, but we give them more, like we give them care and talk to them and listen, because they have no one else. You know, they don't have any family.
Right.
So.
Okay, so Crystal, tell me your age.
I am 35.
35. Wow, looking good. So, okay, so, okay, with that being said, how would you be able to diagnose a person, say, for example, who's been incarcerated for about 25 years and they come out trying to get back in the pattern of society? How, you know, we have it here. They've been in a bubble for so long that their mind is just constantly institutionalized, right?
Very.
How would you address that? How would you approach them, introducing them to like medication or
a lot of education, a lot of you provide a lot of education, a lot of resources. You know, I give out, like, I'll print out something and I'll provide it to the patient, or I listen to the patient. You know, sometimes when they talk to their doctors, it's a very like, how are you feeling? This and that, that they prescribe them a medication without really sitting down and talking to them and putting their time in to talk to them, because they feel like their time is so limited. You know, like when doctors come talk to them, they're not sitting there for hours. They're meeting with the patients for like 15, 20 minutes. And that's how they base it on. That's why I feel like when we come into play, this is when, like, we take our notes and like listen to the patient and we reiterate it and we relay that message to the doctors so that the doctors see a different perspective. Because, you know, your moods can change. You know, when the doctor sees a patient in the morning, their mood can change from the morning till after lunch, you know? But, yeah, I would say basically it's medication education, and I would say, you know, getting them involved into, it's called like occupational therapy, where we get them involved into like groups with other patients so that they can talk about their feelings or talk about, you know, things, and get back into like learning new skills that they don't, you know, they haven't learned or been, you know, or going on the iPad or something, because we do that. That's a part of group and stuff. Just getting them back into, getting it back into like, I would say like how things are like nowadays versus being locked up. Because we do have people who are like locked up or came out of prison and stuff, but they just don't know how to get back out of society.
how to readjust to society, basically?
Yeah.
Okay.
Yeah. So readjusting to society, and I don't know. For me, I feel like it's more communication and talking to the patients and listening and actually like taking it to what they're saying, and, you know, making sure it's getting addressed to the right people, like social work. Like, you know, if they feel like they need help with housing or don't have money for food, and that's when I would refer to social work, listen to their needs, and then, you know, send a message to social work. If I feel like it's a medical thing, and listen to their needs and, you know, do my assessment and then relay it to the doctor, things like that.
Yeah, that was going to be my next question. So you're basically assessing them and kind of directing them to the resources.
Yeah, to the right resources, yeah.
Okay. That's interesting. Well, I like that because I don't know if I told you that I've worked with behavioral health kids also.
That's hard. That's even harder.
With teenagers?
I feel like it's harder than teenagers. Yeah.
It's, I don't know, but you know, my heart's always been with like the youth because of like my experiences. So,
you want to get them into the right direction. Like, for me, like, a goal is to get them more stabilized, to not to break a cycle, or not to set them up for failure. Once you set them up for failure, where are they going to end up? Back into the hospital. You know, I feel like if you take the time and actually see like what can we do differently from the last time they were admitted, so that they don't come back, you know, or set them up to like, they call like, it's not group homes, but it's like boarding cares, or like
transitional homes.
transitional homes that's like a couple weeks before they get back on their feet, as like a step down place for them to go, like those type of things. Like we just don't treat them and be like, oh, they're not on a hold anymore. Like they're not a hold needs to go like 5150 or something like that. Like, oh, they're not on a 3-day hold or a 14-day hold. Like, okay, let's send them back out. They're voluntary. They can leave. Like we tend not to do that because we want to make sure that they're right on their medications before we bring them out into society so that they won't come back.
Nice. I like that. So, okay, I guess in conclusion, I guess what I want to say is, you said that in the beginning of your career, you wanted to do it because you seen the hardship of your dad.
Personal. Like I've seen the hardship of, like, not like hardship of what my dad went through, but seeing that with all these people who took care of my dad, like as far as nurses, doctors, CNAs, speech therapists, or respiratory, like all these people, all this medical team taking care of my dad, how it improved his life, and it's rewarding. I feel like it's so rewarding, but and plus, I had family who were nurses, and of course, like the stability and that played into factor, and of course, income. That was another. Like you wanted to get a career where you knew that it was gonna support you throughout your life.
Right. So, do you feel like you've given your patients the care that they needed?
Absolutely, and more. Just kidding. Yeah, I think so.
And you feel like you have impacted their lives, right?
Oh yeah, because before the job, I work at county right now, so that's a total different than working at the VA because you're working with vets. So with vets, for instance, it's a lot of like PTSD, anxiety, depression, right? And then when people work for county, like San Francisco General Hospital, it's more like psychosis. It's more schizophrenia. It's more like hallucinations, visual hallucinations, like hearing voices, and drug-induced psychosis, stuff like that. Like you see a good difference between not to discriminate or not to put this name on versus like veterans and county. You just see a big difference when you work with like the diverse homelessness, like a community like San Francisco versus veterans who are more stable and have the health care and have housing and stuff.
Yes.
So.
Okay. Well, Crystal, thank you so much for your time.
You're very nice.
I really appreciate you.
Oh, you're welcome. Anytime. I'm glad I can help in any way. You can always call me and I can help you with whatever. But if it's like homework, like helping you with that, I don't Google.
All right, Jody.
Love you.
Love you.
Bye.
Thank you.